This is the first time we've done this in this country, so it isn't typical, but it's been done at the requests and needs of the Muslim community, who've come to us and said, we really need to be able to increase the speed at which we can bury our loved ones.
That was the video of a burial ceremony held in Britain recently for some Muslims who died of the coronavirus. Now, compare what you just watched to the funeral ceremony of another victim who died of the same virus here in Nigeria. This time, that of a high-profile Nigerian. In fact, the Chief of Staff to President Muhammadu Buhari, Malam Abba Kyari.
Ana ba da shawara ba. Kai ka ja wannan abin, ka ja. Ka zo ka ja.
As the death rate from COVID-19 continues to rise globally, many still do not know that it takes a special type of care and rigid process to bury patients who die due to the novel coronavirus. So how exactly is the burial of a COVID-19 victim handled, and what is the proper thing to do? The UK Parliament passed the Coronavirus Act 2020, and most countries are adopting a similar approach. According to the NCDC, the following guidelines must be observed in burying a victim of coronavirus. Funeral attendance should be limited to only immediate family members. This will make social distancing easy, thereby protecting the few numbers of mourners. Burials should take place in a timely manner in accordance with local practices, while funeral ceremonies not involving the burial should be postponed as much as possible until the end of the pandemic. Only burial team members that have been trained in IPC and safe burial practices should be allowed to handle dead bodies and conduct burials. Family members, religious leaders, healthcare workers, or mortuary staff preparing the body should wear gloves, impermeable disposable gown, or disposable gown with impermeable apron, medical mask, and eye protection. The personal protective equipment, also known as PPE, should only be removed at the PPE removal area and appropriately disposed of. Health officials must also disinfect surfaces and decontaminate the entire cemetery. The treatment and funeral of the late Malam Abba Kyari's burial therefore raises more questions. Will an ordinary citizen's body be released to their families and allowed to be flown to any burial place of their choice? Will the government officials who gathered during the funeral be prosecuted for flouting the social distancing rule? Can the hundreds of people who attended the burial be identified and made to self-isolate? Are the people who were close to the graveside with no PPE not now at risk of the infection and a risk to the society at large? Can citizens decide which hospitals they want to be treated? In fact, the Nigerian Medical Association and resident doctors have kicked against designating private hospitals as treatment centers because there is no codified protocol on it yet. Granted, every individual deserves to be treated in any hospital of their choice, and every society prides itself in how it traditionally handles its funeral ceremonies. But in a time of pandemic, fear and uncertainty, it is important that all medical rules and guidelines laid down for case handling or management be adhered to no matter who is involved.